You guys know what an internist is? What we do? An internist is a doctor for adults. Basically, if you have ever listened to music on one of these, you need an internist. Okay? So, we got that out of the way. When I was asked to give this talk, they told me what the topic was, medical compliance. And I thought, really? That's going to be one of the toughest things that I have to talk about. Then I asked how long I have to fill. And they said 40 minutes. We may not get there. But this is one of those things that it can be really simple or it can be really difficult depending on the situation. So, taking medications, it's more than just swallowing pills. It's complicated. Most people that I see have more than 3 medications they take. So there is a risk with that many medications. We call that polypharmacy. Before we can talk about what medicines do, what they can, or problems we have with that, we got to discuss how the medicine gets into your body and where does it go. So if you imagine you're a pill and you get swallowed, you're going to go down into the stomach, mix with some acid, and start to dissolve. You're then going to move into the intestine, where there's other digestive enzymes dumped by the liver, the pancreas, and it all gets mixed, and you start to dissolve further. As you dissolve, you're picked up by the bloodstream. While in the blood, the first stop that you make is the liver. The liver is an amazing organ. It detoxifies everything. It keeps us all alive. It keeps us from dying from poison, really. Any food we eat has the potential to be a poison. Any medicine we eat or take can be a poison. The liver's job, first of all, is to stop that from happening. After that, we call that the first pass. So if your medicine, sometimes over half of that medicine gets destroyed by the liver with the first pass through it. After that, it gets distributed through the whole body. It will make further trips through the liver as it recirculates around the body. It can also go to the kidneys. So the liver and the kidneys are the 2 places where medications are eliminated from the body. All right? If you're more visual, I've got the gross picture to show you. So esophagus, this is kind of spread out. This is the stomach, and then you can see it goes to the small intestine, large intestine, and out. All the blood goes back through the liver. Red's artery, blue is vein. So the only way to get back from the intestine is to go through that liver. All right? So liver metabolism. This is where it can get a little tricky. We have several chemical pathways in our livers that help us metabolize the medicines that we take. They either add on more chemicals, they break stuff up. There's just different chemical pathways with that. The problem with these pathways, they can be turned off or on by different medicines and by different foods. I don't know if you've ever received a warning from your pharmacist, don't take this drug with grapefruit. Okay? It's because grapefruit turns off one of these pathways. So everything gets congested like this traffic jam here. So we have to be careful with what we eat. Medicines are infamous for doing that. We have a couple pathways that 30% of all the medicines we write go through one of those 2 pathways. So this is when the dosing is very important. You have to time things occasionally so that we don't completely bog down the liver and have a backup there. And of course, alcohol interacts with the metabolism of anything. It alters the liver's ability to function. Okay? Other medications that you may not be aware of, Tylenol. Tylenol in excess will do the same thing. So you've got to be careful not to exceed what's written on the labels. Usually it's very safe and interacts with nothing, but once that pathway is saturated, then we can get into problems with that. All right, I'm going to raise this up a minute. I couldn't find a nice slide that I liked. So you're going to have to put up with my doctor drawing. So with any medication, we have what's called a dose-response curve. This is a measure, or it shows us how medications are absorbed in our bodies. Whenever they come out with studies or looking at new medications, every medication is mapped out, all right? Every medication looks like this on the dose-response curve, all right? So right here, the medicine's useless, doesn't do anything. As we get over here on the right side of this, it flattens out. So the dose or the response to that doesn't change much. Side effects increase markedly. The further we go to the right, the more side effects you have. We have less bang for our buck. We've actually had more research in the last few years that showed that if we attack a problem like high blood pressure from different angles with multiple medications, smaller doses, we actually get a better reduction in blood pressure than if we just hit you with one blood pressure medicine and crank the dose all the way up. So if your doctor's giving you 2 or 3 medicines for your blood pressure, small doses, that's why. Less side effects, less, well, a little bit more cost, but less risk. What your doctor does when we prescribe is we'll prescribe doses in between those 2 lines right there. So we know that it's effective at that point, and we'll go up until the side effects are worse than the benefit. And so we lose the benefit. So usually what we try to do is get your medicines right there, right smack dab in the middle. Okay? It's not the same place for everybody. Sometimes we have to titrate, but that's the general idea of a dose-response curve. Now this dose-response curve can be changed by the different medications that you take. Some of the medications or foods change how we metabolize it, so that can also shift that curve for us. Half-life. When you take a medicine, this is a measurement of how long it's going to stay in your bloodstream. We measure that in half-lives. So for example, if I take a pill today, the half-life is when half that dose is left in my bloodstream. Okay? So that varies. For example, Tylenol. We've talked about this a little bit. You take it every 4 to 6 hours. So the half-life of that medicine is 2 hours. If you're on a thyroid replacement, the half-life of levothyroxine is 14 days. So the pill you take today, half of it's still going to be in your bloodstream 14 days from now. Every pill is different, so that's why we can't say they're all the same and work the same way. They will all have different half-lives. Now, once again, if the kidneys or liver are not working correctly, then that half-life changes. As we spend time on planet Earth, the liver doesn't work quite as well and the half-life changes. So, medicines that you've been on for 20, 30 years, all of a sudden may be too much. We may have to reduce it. Everything ingested reacts with everything else. Foods, drinks, medications, it will all interact with each other at some point. And then actually, good things are in excess are not so good. Not only do the side effects increase, but the medications could turn toxic. It doesn't even need to be medicines. Water can do that for you. If you drink too much water, you can waste your electrolytes. So anything in excess is bad. All right? We talked a little bit about this with the grapefruit. Certain foods can do this. Vitamins and supplements. Time and time again, I get patients that come in they're taking 2 or 3 medicines that I prescribe, but then they take a whole list of vitamins and supplements. Okay? We have to be careful with those. These are medical foods that are cleared by the FDA as only supplements. They don't have the testing that's required of your regular medications. The standard for medications is called a double-blind study. This is a study wherein there is a placebo used. The patient nor the doctor knows which the patient's getting. So when you sign up for a study, if you ever do one of those, you may get the study medication or you may get placebo. The doctor running the study will not know. The data is collected somewhere else. They put it in a computer, crunch the numbers, and find out if there is advantages to taking this medicine, if there's more side effects, or whatever it is. So we have to show that there is advantages to taking a medicine before the FDA approves it. We also have to show that it's safe. There's a whole bunch of labs. Every time we do a study, people have to have blood work. They have to be compliant with that and show up. And if there are bad things that happen with it, the drug is pulled and we stop the studies. If it makes it to market, they still monitor that. That's why you hear drugs are being recalled. They found stuff that happened afterwards. We also have to prove drug-drug interactions. So that's all part of our studies. Supplements don't have to do that. In fact, they don't have to even prove that they're superior or have an effect. All they have to show is it's a vitamin that our body uses or a mineral that may have benefit, and it can be marketed. We don't know the drug-drug interaction for some of these. We do know that some of the data, we have some data, but not everything. For example, a few years ago, and this is a sore spot with me, I missed 2 test questions on the national boards because of this. There was a fad to take vitamin E in higher dosages because it was supposed to be cardioprotective, protect your heart, keep you from having that stroke and heart attack. 2 years after that test, we found out that it actually causes plaque formation in the arteries. So the claims that came out with it were unfounded, and actually it was pretty dangerous for people. So that's why I put this up. Be careful. The biggest thing you can do is let your physician know what you're taking. You know, don't assume that because it's from a health food store, he doesn't need to know, because there are some drug-drug interactions with that. We'll go on to the medications. Now, I'm going to take you through my thought process. Whenever I prescribe a medication, I want to first use the standard of care. I see 70% of my practice is diabetes, and there are drugs that are recommended for diabetes. They want you to control their blood pressure with what's called an ACE inhibitor. You're supposed to be on a cholesterol medicine. You're supposed to be on an aspirin a day. These are all the standards by which I am judged nationally. But I have to look at that. If I need something to treat a blood pressure problem, I'm going to use the standard first and foremost. And usually the standards that's required nationally of the physicians are generics. So they're the cheapest medications out there. They've been around for years. We know they work, okay, and they do what they're supposed to do. And then I'm going to look at the medication list and see if I can replace anything with the new medicine that I'm prescribing. Can I get rid of 2 or 3 medicines off your list and put it in one pill? That's what I try and do. If your doctor, while you're talking about medicines, pulls out his telephone and starts punching rapidly, he's not sending a text. Hopefully not. There are medical apps that are available to physicians, nurses, that actually allow us to look up each medicine. It gives me the full prescription. It lets me see dosages, any side effects, any drug-drug interactions. It lets me see cost. So it's a big benefit. And the other thing is it lets me do is if you come to see me, I can plug all of that in and push go, and it gives me all of the possible reactions. So if your doctor's tapping wildly on his phone, he's probably doing that, checking out your medications, making sure that everything works good. I also consider what side effects can be expected. If there's a common side effect, I'm going to warn you about it. I know that you're going to get a monogram with the medicine, and then if ever there's a question, I have those monograms that I can provide for my patients. And I'm going to ask myself what's going to happen with each of the medications. What do I expect of my patients? I expect that the medications are taken as prescribed. We talked a little bit about how we get the dose that we're supposed to take. So when I prescribe a medication, my expectation is if it says once a day, you're taking it once a day. It's not a pick or choose. Oh, that one I don't like today, I'm going to take it tomorrow. That becomes really hard when I'm trying to treat a chronic problem. If a medication is making you feel bad, then I want to know about it, especially if you get a rash. I want to know sooner than later. And sometimes you can get rashes on the arms and legs, but the big one that I'm worried about is chest, back, upper extremities, on your thighs. Those are usually the allergic reactions. There are some other forms of allergies, but if you do get a rash, then I want to know about it. And then whenever I start a new medicine, I will always have a follow-up. If your doctor said that doesn't give you a follow-up date, he gave you new medicine, I'll see you in a year, you probably want to get in a little bit sooner so they can check and make sure it works. If it's a blood pressure medicine, we need to see that it's lowering your blood pressure, that you're not getting a cough, that you're not getting dizzy, that it's not going too far. If it's going too far, that's not right. Then we need to change it. And report all of your medications that you're taking to every physician. Most of my patients have 3 or 4 different doctors they go to. They go see their heart doctor, they go see their kidney doctor, they see me. I've had patients in the past come through and say, well, you didn't prescribe that for me, so I didn't tell you anything about it. That can be really dangerous, especially some of the medicines that the subspecialists prescribe. If I don't know that a patient's taken that, what I'm giving them could turn to poison and be very, very dangerous. So any medications that you are taking, let every physician know, whether you take it in a list or you just take a bag and throw all your pills in it before you go to the doctor. That's going to keep you safe. So we want to know exactly what you're taking and also the vitamins. And then I expect that if I've given a prescription and it's good for a year, that it's being refilled. I get notifications from insurance companies on a daily basis that my patients may or may not be taking their medications as prescribed because they didn't refill their Zocor or they didn't refill their anti-anxiety medications. So that my job is that I need to check on that. Now, if it's causing you problems or you don't need it anymore, fantastic. We need to know and we can take it off your medication list. Not a problem. If it's to treat a chronic problem, then we need to talk about it if there's a reason why it was stopped. But otherwise, we expect that the refills are being refilled in a timely manner and there's no gap in taking the medication. And then one of the most important things is you have monitoring if needed. For example, warfarin, Coumadin. Great medicine. It's kept a lot of people alive. It's prevented a lot of strokes in people with atrial fibrillation. Warfarin is also the main ingredient of decon, the stuff we use in rat poison. Okay? So why is it beneficial for us to give you rat poison? It's beneficial because we can control the dose. We have set parameters, but we have to monitor. We have to have blood work at least monthly on that to keep you safe because your diet, other medications, once again, can interfere with this. The decon works because we don't monitor the dose in the rats. We give a high dose and they actually have a stroke. So when a doctor asks you to do blood work, follow up, we really do need it to keep you safe. All right. If you have questions about your medicine, please, 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 please ask your doctor. If you want some written materials, please ask. I know in my clinic I can produce a monograph on every medicine. I can get you a handout on just about every medicine that's written in layman's terms. Most physicians have this ability to do. And if you have any questions about what you're taking and why, the doctor should have the time to sit down and talk to you, or his assistants can do that. My favorite lately, Robert DeBry, comes on your television, if you're taking Actos, call me now. The state of Utah just passed a law that help prevent frivolous lawsuits, which is raising malpractice or your physician's cost of doing business. So a lot of the law firms that previously were filing multiple lawsuits against doctors, hoping for the easy payout, can't do that anymore. So now they're going after the pharmaceutical companies. That's why you're seeing an increase in these class action lawsuits. Okay? If they raise a concern, call your doctor. Don't just stop taking the medicine. Okay? There's usually a reason why there's the class action lawsuit. Chances are it's because it was the patients in that lawsuit were not being monitored, were not taking their dose correctly. We see that Actos is a good point on that one. So if you do see one of those and have concerns, please call your doctor. Pharmacists are a great help with this. What do you do if the pharmacist has concerns? Well, Mrs. Smith, I'm not sure you should be taking that one. This goes back, the doctor may have missed a medication. The pharmacist knows everything, especially if you're getting it all filled at the same pharmacy. So you listen to what the pharmacist says. Ask your pharmacist to call the doctor. I don't like having the patient be the liaison. I'd rather have the pharmacist call me and say, hey, did you hear about this? Recently, the FDA changed some pain medications. I don't know if you've heard of Lortab. It's a narcotic pain reliever that has Tylenol in it. They recently came out and banned basically all preparations with 500 milligrams of Tylenol in it. No one notified the physicians. They notified the pharmacists. And so we started getting angry phone calls from the pharmacies in the area. You can't write that anymore. Why? Well, this is one of those things that they should have called and said, hey, did you hear that you can't write this anymore because the FDA has banned this? So this is one of those things that they got the information that we didn't. I got my first notification yesterday, and this has been going on for about a month now. So sometimes it's okay to ask the pharmacist to call the doctor to discuss the issue. And then feel free to call your doctor. He wrote the prescription. Let him know if there's any problems with it. Now this is the fun stuff. Okay, my medication's changed. What do I do with this stuff that's left over? Turn your medications into the police department, especially if they're pain medications, narcotics, something that other people can get a high off of and they'll ransack your garbage for it. Other medications you can mix with an unpalatable substance, such as coffee grounds or my favorite, cat litter. Cat litter is actually pretty good because used litter has a high amount of ammonia, and that does denature a lot of medications. So it's pretty good for that. And I learned while preparing for this that you should destroy the labels. If you think about it, what's on that label on that bottle? Your name, your birth date, your address, your phone number, doctor's name, and medications. That is a really good way to have identity theft, especially if you're living in a bigger community where lots of people take medications. Pull the labels off, destroy them, cut them up, do whatever you need to do. And then please don't flush. The DEA has a list of medications that you can flush if necessary. However, all of our water goes to the Great Salt Lake. So if we have everybody flushing their narcotics, then we're going to have some birds that are pretty high on opiates because it's not taken out in the sewer treatment. So that's why we're saying don't flush. Take it, if you are on a pain medication that you no longer need, take it to the police department or take it to your doctor, have them dump it in their sharps container. Something like that that will destroy it. If you're on a patch for pain, most patches when you take them off, they're useless. You can stick them on a piece of paper and throw them away and it'll go to the burn plant, not a problem. Fentanyl patches, they have a gel inside. When the patch is used, the gel still has narcotic in it. Druggies will cut those open and suck it out. So if you are on any of those, put it on a piece of paper, roll it up. You can take it to the police department on that one. Any questions on this? It's pretty straightforward. Going back to the pharmacists, The pharmacist will put lots of labels on your medicine bottles. I had one the other day come through with a patient. The label was sticking that far off the bottles because it had so many stickers, warning stickers on it. Pay attention to those. If they say don't take on an empty stomach, don't do it. If they say take with food or take 2 hours before you eat, try and do that. Talk to your doctor if you have any questions about that. This is one of my favorites. What do I do with leftover antibiotics? Do I share them? No. The medications were given to you. That becomes very dangerous, sharing medications. I hear that all the time. The other favorite is, well, I had some leftover Cipro. You're not supposed to have leftovers. We give you enough antibiotics to cover the whole course, the whole treatment. You're not supposed to have any leftover. Antibiotics don't cover all types of bacteria. Certain antibiotics cover certain types of bacteria. Others cover others. So when you come in for a sinus infection, that's a different bacteria than the bladder infection you get 3 weeks later. Okay? So the same antibiotic may not even make it to the bladder. Don't start taking the antibiotics you got left over. You shouldn't have any. Don't start taking them, though, to cover the different infections. Okay? They won't work. Now, we get into a real problem with drug resistance. You guys are all familiar with Darwin, the rule of selection, a little bit. So when you take an antibiotic, the first 2 or 3 doses are going to kill off at least 70% of the bacteria. Why didn't it kill all of them? That's a good question. It could be penetration. The antibiotic may not get into everywhere that it's supposed to quite yet. Or it may be a little bit of resistance. The antibiotic may weaken those bacteria, but if you stop it too soon, it didn't quite kill them. So now it's survival of the fittest. All right? So the next time that you get sick, have the same bacteria, that antibiotic may not work because that bacteria is left over from the first time. It's a survivor. It laughs at the new antibiotic because it's already seen it, done it. You can't hurt me. So we want to make sure that you take all of it. We're seeing an increase in community-acquired resistant bacteria. The biggest one is called MRSA. It's a staph. If you ever get what looks like a bug bite on your arm or your leg, and you haven't seen any bugs, especially this time of the year, there's no spiders. The spiders are all dormant. There are no mosquitoes right now. If you see a bug bite and you think it's a bug bite, chances are you scratched. And now you've got that resistant staph. See your doctor. Prescriptions aren't to be shared. All right, pain medicines. We've talked a little bit about Tylenol. It's been in the news. In fact, the FDA was threatening, and they're still threatening, to pull Tylenol off the market as an over-the-counter. Because people think it's over-the-counter. I can take as much as I want. No. If you exceed the dosage on that bottle, then there's a real risk that you could be overdosing on Tylenol. Tylenol is sneaky, or acetaminophen is sneaky. It doesn't kill immediately. A person that takes a whole bottle of Tylenol, they're not going to die today. They're not going to die tomorrow. 2 weeks later, their liver necroses, and then they die. So this is why the Lortab is being pulled off the market, so that because of the Tylenol amounts in it. Okay, people were overdosing on the Tylenol. So be very careful. Look at your medicines. If you're on a pain medicine that has acetaminophen in it, make sure you look at the bottle of Tylenol you're taking and do not go over the amount that's listed there. Currently, it's about 2 grams a day is all that you're supposed to have. Not all in one dose, but throughout the whole day. The anti-inflammatories, ibuprofen, naproxen, aspirin, and there's a whole slew of others, Celebrex, meloxicam. They're all different kinds that your doctor can give you. Don't go over the amount on these. These cause bleeding problems, they can cause ulcers, and most importantly, they can cause kidney damage. They're very safe if they're taken correctly, but when they're not taken correctly, it can cause severe damage and severe problems. Opiates, these are the narcotics, okay? It's getting a lot of news lately. This last year, the state of Utah started cracking down on physicians that were writing an excess amount of these medications. Most of the time when an opiate prescription is given, it is for acute pain, not for pain that's been out for a long time. There are certain preparations that have been approved for chronic pain, but most of the Lortab, Narco, Percocet, Vicodin, that is for acute pain. You fell down, you broke your hip. That's when we want to give this, okay? All of the narcotics or opiates affect the brain in a similar way. We actually have two set points in our brain when it comes to these medications. The first one is your sleep threshold. The second one is your respiratory threshold. You take too much of these and you stop breathing. That's why it's gaining all the press. So, problem is if you're taking it, things can change. If someone takes a narcotic that is not used to taking narcotics, they can take one and they're probably going to go to bed and sleep for the rest of the day. They're not used to that. You hit your sleep set point. If you take these medications chronically, that set point can start increasing. So you can become more and more tolerant of that until it reaches the respiratory drive. The respiratory set point does not change. It is fixed. We don't know what that is for everybody. It is different for every individual. When people get into trouble is when they're taking the chronic narcotics and they end up going to the dentist or something, and then they get into real problems. Case in point, I had a patient come in yesterday. Chronic back pain, he's on all kinds of medications for the back pain. Something popped in his back and he started having weakness in his leg. He went to the emergency, did the exact right thing, went to the emergency room. The doctors gave him a shot of painkillers. He was great, went home. Well, when he got home, he thought, I don't want to have this pain again. I'm due for my next dose. So he took his next dose. 3 hours later, he was back in the emergency room with an overdose. It wasn't intentional. He just didn't think about it, and the doctors didn't caution him about it. So if this ever happens, you're on these chronic medications, make sure you talk to the doctors and find out, okay, am I cleared to take the next dose? Should I take the next dose, or should I wait, see what happens? You know, we don't want to get to that respiratory problem. Luckily, I haven't seen any of these overdoses in about 8 to 10 years. I used to see it all the time as a resident at LDS and the University of Utah. So, in summary, take your medications as prescribed. Report all medications and medical foods to your physician. Discuss all possible allergic reactions with your doctor. And dispose of expired or old medications. In summary, compliance with medications is important, otherwise you may end up swimming with the sharks. Thank you.